Am I visible to all? Am I audible to all? Can all of you see me? Can all of you hear me? Just a second, all of you will. Yes, welcome all of you. Yes, welcome all of you. And just can somebody use the chat box so that I know that audio, visual, everything is clear? Am I visible to all? Am I audible to all? Welcome all. Yes. Okay. So I hope the exam was good. OBGY kaisa tha? I think OBGY, everybody has so many messages I am getting. Yes. Hi Balaji. Hello. How are you? Yes. Hi. Okay. So yes, audio, video, all is working well. And thank you all of you for joining in today. We are going to keep it like a very short session. Don't worry. And now is your time to rest and relax also. But very quickly, we'll be going through all the OBGY recall questions. As I repeat, these are recall sessions. So questions may, of course, some changes would be there, and this might not be the exact questions what all of you must have got it in the examination. Thank you, friend. Yes, Umesh, fantastic. Thank you. Yes, so I'm very happy that all of you, so many messages from the students. And before we proceed further, I will want to show you this. So many messages, sir. Thank you for everything. OBGY was really easy because of you, and you are the real OG Guru. And thank you, sir, that because of your examination, all questions in OBGY are correct, thanks to your lecture series. Okay, and those who are preparing for the upcoming July examination and next year January examination, please download the OGGuru app. And even those who have taken only the RR course, master class is available only at 1500 rupees. Get in touch with me on phone and WhatsApp on this number and download the OGGuru app for all your upcoming future examinations. I'm sure if you'll clear the FMGE examination for NEET PG also, these lectures are going to be helpful to you. So let us begin. And as I said, I would want your feedback in the questions, whether these are good afternoon Varun. Okay, I would want your feedback कि ये questions थे या क्या changes था या whatever was there. Okay, so let us begin the discussion. And this is the recall question. Chalo, question number 1. All of you, I'm sure all of you must have got it correct. Yes or not? OG in the chat box. Okay, तो क्या था question? We have got a young girl who has come to us with delayed and irregular cycles, and ultrasonography is seeing this. What is this? Yes, thank you Umesh. Thank you Umesh Ada. बेटा सेशन खत्म होने के बाद सेम थिंग आप कमेंट में डाल देना. Okay, same thing, go and comment after the live stream is over. Yes, all of you absolutely correct. It's probably the simplest question tha. This is also a repeat. This question has been asked in the past. And this is the, you can see multiple small follicles arranged in the periphery, neck, nothing to what you call necklace pattern or string of pearl pattern, necklace appearance or string of pearls, clear cut, very easy, probably the easiest question, and that is PCOS, polycystic ovarian syndrome. I'm sure सबका, yes or no? Yes, thumbs up. सबका correct हुआ था कि नहीं? All of you must be remembering me on the day of the examination, also in the examination. All overall, I got a feedback that sir, among all subjects, OBGY was the best. Yes, exact question. Thank you very much. Okay, moving on, nothing much to discussion. Just quickly, thoda sa aage for extra information, you should know the Rotterdam criteria which could be asked to you in the exam, and management and all that is for the discussion at a later date. Abhi to khali hum recall kar rahe hain, so we are going to just give you the question and the answer and the relevant thing. Yes, chalo, what is this? Chalo, tell me, ye kya tha? Okay, so in early pregnancy, sign is given to you. What is the image shown to you? Okay, so it is, you can see, okay sir, it is bluish discoloration of the, thank you Balaji, thank you. Okay, bluish discoloration of the cervix and the vagina, which is what? It is your Chadwick sign. Okay, so bluish discoloration of the vagina or dusky hue. Okay, bluish or dusky coloration of the cervix, and mainly it's for vagina, but the picture is shown to you of the cervix. This is vasocongestion. Because of congestion, Goodell sign is cervical softening. Goodell mein, all of you, I told you, lips are soft, tip of the nose. So in pregnant cervix, Goodell sign mein cervix becomes soft, which is of course on PV examination you can do the Goodell. And Hagar sign is bimanual approximation, approximate fingers. And what is Osiander sign? Yes, Osiander sign is pulsations in the lateral fornices, pulsations in the lateral fornix. That is because of uterine artery pulsation. Chadwick sign, one more name. Okay, in case next year अगर question change होके आता है, Chadwick sign, what is another name? Can anybody tell me? और एक sign क्या था? Chadwick का दूसरा name क्या था? So Chadwick sign, Jacquemer sign. Okay, Jacquemer, Jacquemer. So Chadwick sign or Jacquemer sign. I'm sure सबका correct हुआ होगा. Yes, and I'm sure all of you must be enjoying. चलो, ये again as I told you in the हमारा prediction also कि primary amenorrhea, absent uterus is a must know topic and you get questions every year. Good morning, Dr. Mohan. Yes, so good afternoon. Primary amenorrhea patient has come to you and on ultrasonography absent uterus. So when you have primary amenorrhea and absent uterus, what are the only two possibilities? Sir, either it is RMKH or it is your androgen insensitivity syndrome. I told you, sir, Turner's syndrome, uterus is present. It is not uterus is absent. I told you, chota uterus, chintu uterus, a hypoplastic uterus, but the uterus is present on Turner's syndrome. Is this understood to all of you? Yes. And what are we supposed to look at it? Sparse. Axillary and pubic hair is sparse. Any extra information was given? Anything about the hormone levels? Anything else was given? And of course, ultrasonography, no uterus, no ovary. In MRKH syndrome, ovary is perfectly normal. Yes, all those who said correct. Option number A, complete androgen insensitivity syndrome is the answer. Favorite talk. Very good. Yes. Okay. So ये आपका AIS है and sparse or absent. Okay. Axillary pubic hair could be sparse or absent. That is the clue and that is what it is. Okay. Yes. Is it understood? Anything extra in the question था अगर कुछ या options were different, you can please comment in the chat box so that we know. Okay. And these are very okay. And here you know gonads present is ovary. Here gonad present is testis. Breast is well developed in both. So don't look at that. Okay. Breast is both may normally present. And here we are supposed to look at axillary and pubic hair, which all of you know. Here it is well developed and here it is absent. Yes, I think again से हमने जो of course हमारे all images we had shown in the OG booster course also live, which I took. So many images have come from that OG booster course and many of you have told me. Yes. Inguinal gonads given. Yes, infamous serum testosterone level was given. Okay, okay. Infamous mango. Okay, serum testosterone must be in the male range because it is male. Okay, one more thing. Of course, you know this is 46XX and this is 46XY. We have also done match the column. Yes, absolutely correct. When we have got history of passage of grapes like vesicle, that itself is a clincher. Beta HCG very high. All these are signs. And ultrasonography, all of you can see multiple fluid filled grapes like vesicle. This is the famous snowstorm appearance. Yes, snowstorm appearance. And that is the complete vesicular mole. Breast pen किसमें था बेटा? In this complete vesicular mole. Okay, a complete vesicular mole. Okay, history of passage of grapes like vesicle. Simple. Partial mole में you will also see some fetal part along with the snowstorm. Okay, and missed abortion में you know there will be a baby with fetal pole, but there will be fetal cardiac activity absent. Okay, this was 13 weeks. Okay, 12 weeks, 13 weeks. Chalo, that is good. Thank you. 13 weeks, 12 weeks. Answer will not change. Very good. James Bond, thank you for telling. Okay, yes, and all of you know, okay, sir, when it's a only snowstorm, this is snowstorm, complete uterus is filled with grapes like vesicle. That is your बेटा वो 2400 दूसरा में HC जीता. Okay, yes, this is your snowstorm, this is your complete mole pregnancy. And in partial mole what it is? Sir, partial mole baby भी है, baby is playing with the snowstorm. Okay, so you will see some fetal tissue, and if you see the baby playing in the snowstorm, okay, if you see fetus also, fetus plus snowstorm, then it is. So ये next time के लिए question आ सकता है कि complete snowstorm is a complete mole, and अगर if baby part is seen then that is a partial mole, partial mole. Okay, so I hope all of you सबका correct हुआ होगा, and I'm sure all of you have done very well in the treatment का next question है correct. Okay, very very important. Post menopausal lady, this is our favorite topic. We start the discussion with this master servant relationship, yes or no. तो यहाँ पे when the lady is post menopausal, when the lady is post menopausal, hot flushes वजह, what are the levels of FSH, LH, estrogen, progesterone? Okay, is this understood to all of you? Thank you, Aman Soni. All questions from the notes and the images. Superb. Thank you very much. Okay. Yes. So all of you know, okay, sir, pituitary is the master, and ovary is the servant. So when the lady is post menopause, ovarian function is completely finished, and therefore the pituitary will increase the secretion of FSH and also the secretion of LH. This is again a PYQ, that FSH more than 40. Okay, FSH more than 40 is suggestive of menopause. याद रख लेना, because it will give you more information also. So that is there, and of course ovarian function is completely over, so even to go down. Of course even progesterone will be low, because no ovulation, no progesterone. Is this understood to all of you? 54-year-old lady tha, very good, thank you. 54-year-old patient, and what is it? Sir, FSH low is wrong. Okay, FSH low is wrong. FSH high, LH also high, estrogen is low, and progesterone is also low. Is this understood to all of you? Yes, very good, Balaji. FSH, LH increase, that is correct. But remember this, that progesterone, estrogen also will be low. Estrogen low and progesterone also low in postmenopausal lady. Very good, very good. Yes, again a very good question. We have discussed this. Okay, when there is dysmenorrhea in a patient, but we had discussed, we had also told cyclical hematuria, any cyclical bleeding, during menses. So during menses patient can get bleeding from the nose, during menses patient can get hematuria, during menses bleeding per rectum, blood in the stools, hematochezia. Okay, hematochezia is your bleeding in stools. Okay, bleeding in stools, and a nodule felt. What it is? Yes, absolutely correct. Endometriosis, specifically rectal. So in the rectal, okay, extra ovarian, rectal endometriosis, a nodule is felt, that is your endometriotic nodule. Okay, so last 2-3 years back scar endometrios ka question tha, and this is your endometrius. All those who have joined in right now, also the recordings will be available, of course, so you can see the first few questions, because you have discussed already 4-5 questions. Many of you have joined in right now. Okay, so this is your rectal endometriosis. Why? Because the dysmenorrhea and bleeding per menses whenever she has got her periods. So basically cyclical. Sir, whenever there is painful defecation, urination. Okay, Bethate, fine. Okay. So as you know, okay, there is that nodule is there. This is suppose is the rectum, and there's a nodule over here. During menses it erupts like a volcano, we have told you, and then you get bleeding per rectum or bleeding in the stools during periods. Okay, main clincher is during menses. Okay. Yes, moving on. Yes, this was the question what all of you told me. Best treatment of a woman with complete vesicular mole. So in complete vesicular mole, we are not supposed to induce labor. Why? Jail. Okay, because if you induce labor, half grapes come out, half go out, and what it is, only methotrexate we don't give. And yes, suction evacuation. Okay, no need to do hysterectomy, of course. So suction evacuation is the treatment of choice. And here remember, whatever may be, okay, best treatment or the treatment of suction evacuation. And one more thing, suction evacuation has to be done irrespective of the size of the uterus. Okay, irrespective of the uterus size. That means, suppose, I think in the question uterus size was not mentioned, but let they tell you complete vesicular mole, let it be 12 weeks, let it be 20 weeks, let it be 30 weeks, let it be 36 weeks. I am teaching you for the future exams also. Okay, So whatever may be the weeks of gestation, we are supposed to do suction evacuation only. Is this understood to all of you? Yes. Now again, a very good question. The image, we have told you the TV, YU, all the shape. I'll show you how the Y shape will look. And this is from the history only. History से ही आप सबको पता चल जाएगा. It's a Gravida 3 abortion 2 second trimester, history of 2 second trimester losses in the second trimester. Okay, 2 losses. Okay, was it painless, painful दिया था? Painless या painful, was it given to you? Okay. Okay, 30. Okay, fine. Super. Okay. Yes, 30. Okay. Yes. So, was it given to you? Yes. So, this is even based on the history, and all of you can see, okay, sir, the normal cervix. Okay. Normally, when you look at the cervix on ultrasonography, it is a T. T-shaped is good. Yeah, USG was given, of course. I'm also, okay. T-shaped. So, T, you can, all of you can see a T-shape ho raha hai. This is the T, and T is normal, the T. Okay, so T is normal, or we call it as a competent os, competent cervix. T-E-N-T, competent. Okay, but when the cervix starts opening, and what will happen, sir? This is called as funneling. This is called as funneling. Okay, all of you can look over. Okay, so suppose the cervix is like this, and if it starts opening from up, we will look like it will look like a funnel, which you do in our school ka experiments. So this is a incompetent cervix. And you can see same thing is over here, perfectly correct. You can see this Y. Okay, and then this, yes or no? So this is the cervix is opened from above. So this is the funneling. Okay, funneling was shown, which is suggestive of, what is the answer? Cervical incompetence. Okay, यहाँ पे anything was painless, painful given to you. Okay, so this is the Y thing which you get. Okay, Y thing which you get. Okay, the Y-shaped cervix, or Y, which is a part of your funneling. Okay, part of the funneling. Okay, it's a degree of incompetence. When cervix further becomes opens up, it becomes the shape of letter V. Okay, is this understood to all of you? So Y may say next time they can give, when the cervix keeps on becoming less, you get letter V, and when the cervix is actually open, the membranes herniate out, and you get a shape of letter U. So all these are degrees of incompetence, cervical incompetence. Okay, very, very important. Yes, chalo. Again, I'm sure all of you must have got it correct. Contraindication for methotrexate in unruptured ectopic pregnancy. HCG level कितना दिया था? So my dear student, what is the contraindication they have asked you? I'm sure all of you should have got it correct, sir. When the gestational sac is more than 4 centimeter, more than 4 centimeter becomes a contraindication, and the levels more than 5,000 micro international units per ml. That is the what do you call, that is the contraindication. And of course, when there is presence of fetal cardiac activity, that becomes the contraindication. Is this understood to all of you? Okay, so sir, because why? Because sir, when fetal cardiac activity is present, then the methotrexate success is lesser. So this is the answer, presence of fetal cardiac activity. HCG given was 2000. क्या था levels? Anybody? Was HCG how much given? 2000 था, या HCG was whatever 2400, hardly matters. That is fine. Yes, correct. Thank you. Okay, yes. Okay, so no, C ne beta. Okay, Aman Sonis. Okay, presence of fetal cardiac. Sac size 3 centimeter is okay. Sac size 3 centimeter is fine. Primary multi ऐसा कुछ नहीं है. Of course, it should be unruptured ectopic. Patient should be stable. Okay, in a stable patient. That is understood. Moving on to the next. Yes, again, very simple. All of you should have got it correct. Anybody? Yes, OG in the chat box. Yes, 2000 diya tha. Very good. Okay, Bibi Sahiba. Okay, yes. Hypertensive lady has come to you with contraceptive advice. What is contraindicated? Again, I told you OC pills, copper T करके ही जाना है, and I'm very happy. Yes, okay, sir. Copper T, no problem. Even LNG IUD, it's a local LNG is being released. Of course, barrier is like considered one of the safest method of birth control. What is the answer, all of you? Chalo, I want all of you to tell me the answer. OC pills, sir. OC pills are avoided. And इसमें भी remember one thing, OC pills का के yes, perfectly correct, infamous one. Okay, OC pills are contraindicated, and when it is just hypertension है तो relative contraindication. If it hypertensive retinopathy, severe hypertension becomes absolute contraindication. So OC pills are best avoided in hypertension as well as in diabetic patients. Perfectly, I'm sure सबका correct हुआ होगा. Very good. Again, a very nice question. Para 2 living 2 does not want any further pregnancy. So we want to do permanent method. Permanent method में what I have taught you is, sir, permanent method of female, it is called as tubal ligation or sterilization. When I open up the abdomen, I do a laparotomy. We take a small cut, so it is called as mini laparotomy. Okay, and here what we do, sir, we do the Pomeroy's technique or the modified Pomeroy's. But nowadays, this was not given laparoscopy. Sir, laparoscopy also we can do. And what we do in laparoscopy, yes, we can apply the silastic bands. Picture I had shown you, silastic bands we can apply during laparoscopy surgery. Very good. No, beta. So you don't do a salpingostomy and a salpingectomy. Salpingectomy नहीं करते. In case salpingectomy कब कर सकते हैं? Again, very difficult. Yes, sir, once already tubal ligation has been done, and then still the patient conceives, then you can think of removing the complete tube, so salpingectomy. So we don't do a salpingostomy and salpingectomy. Salpingectomy is the preferred treatment in ruptured ectopic pregnancy. So here we do the Pomeroy's method. Is this understood to all of you? Very good. So I'm sure all of you must have got it correct, and many of you must have got it correct. Okay, so this is basically asking you for permanent method, and in case, of course, it's not supposed to be reversal, but reverse कर सकते हैं when there is patient wants future में babies, we can reversal कर सकते हैं. So laparotomy में we do the Pomeroy's technique or the modified Pomeroy's, and in laparoscopy we do. The question in which the condition will treat with methotrexate in a topic pregnancy. हाँ बेटा, ectopic pregnancy. We will treat with methotrexate. Okay, if it was which will treat, but I have got it everywhere. It's a contraindication for methotrexate. Okay, option D was salpingotomy. Okay, very good. So वो भी नहीं करते हैं. Okay, salpingotomy, ostomy वो सब नहीं करते हैं. What is salpingotomy and all that? So that is done during the unruptured ectopic. Again, it is as I tell, क्या बताते हैं? कचरा dustbin. Okay, sir, suppose there is a ectopic pregnancy and you want to save the tube. Okay, you want to save the tube, so you cut open the tube. Okay, and you cut open the tube, remove the ectopic pregnancy out, and if you keep it only open, that is called a salpingostomy, and you cut open the tube and you suture it back, that is salpingotomy. So all that was not done, all that is not done. Yes, contraindication was asked and therefore I told you. Okay, so ये सब नहीं करते हैं. Very good. Yes, again as I told you that this image I had shown you in my OG booster, and of course we've discussed this. This is, please understand, the baby is in transverse lie. Routinely this is not done. This is dangerous. So the baby is in transverse lie. We are putting the hand inside the uterus, catching hold of the baby, and the transverse lie. This baby is in transverse lie and we are making it into breech, and then we do the breech extraction. Is this understood to all of you? So this is basically internal podalic version. Remember, externally we do external cephalic version. So this is not for cephalic delivery. This is not for breech. In breech we do external version, and this is the only place in modern day obstetrics. Internal podalic version is almost like outdated kachra dustbin. If the first baby is transverse, okay, remember this for the next year. If the first baby is in transverse lie, what do we do? If the first fetus is in transverse lie in a twins, we go for LSCS only in the twin. But sir, this is in a case, it's not B. Okay, second baby. Okay, if the second baby is in the transverse lie in a patient of twins, then you can think of doing this. Is this understood to all of you? Yes, very good. Okay, so delivery of the second twin in transverse lie, and that is the internal podalic version, which you may do. Yes, okay. So this is a transverse lie. Patient is in transverse lie, we are converting it into breech, and this is followed by breech extraction. It is internal podalic version. I repeat, suppose you get an MCQ, okay, so there is twins, and the first baby is in transverse lie, then you have to go for LSCS. Is it clear to all of you? Yes. Now ये थोड़ा सा controversy है, because every student has told me different कि क्या था, कौन सा picture था. You will have to tell me. We have discussed all in our lecture. Was it a mirror image? All of you know this is your CTG, cardio tocography. Cardiotocography में cardio means the baby heart rate and T means toco. The tocography is the uterine contraction. So you can see in the picture, this is the fetal heart rate and these are the uterine contractions which we are getting. Okay, many students told me, okay sir, it was exactly like a mirror image. Okay, so you know basically at the early variable late, the words used are in relation to the uterine contraction, and all of you very good. Okay, so suppose what is this picture? Chalo, tell me what is this picture? Okay sir, when it is a mirror image, okay, when it is a mirror image, that means the heart rate is going down along with the contraction. This is the peak of contraction, this is the lowest point nadir, and this the recovery is taking. If it's a mirror image, then it is a early deceleration. So I don't know. Okay, no mirror, very good. Mirror was not there, very good. And here this picture what I'm showing you, this is the late deceleration. So early is the mirror image, and here you can clearly see in the upper part, okay, so the contraction is already over. The peak of the contraction is there, and then the heart rate cut dip part is the nadir or the lowest point. Okay, the lowest point or the nadir is after. You can clearly see it is after. So this picture is late deceleration. Okay, and same thing is over here. कैसे ये हमारा contraction है, and after the contraction is over, then the heart rate is going down, and then the recovery is there. So this is late. Yeah, this is I know better. It's a tough thing. Many students told me कि sir late था, and many students told me, as all of you think, it was variable. We'll just picture. Okay, left वाला picture था, मतलब ये first वाला, yes, then it is variable. Okay, because you can see it is going down afterwards, and this. So concept you need to keep in mind. Naimuddin, thank you, beta. Very much thankful. Thank you, beta. Please tell all your friends and juniors and colleagues also about this app and make them enroll also. Yes. Okay. So variable deceleration will be what all of you look over here very quickly. So see, if this is the uterine contraction, everything is in relation to contraction. So when the baby heart rate drops down, after the peak, this peak is coming, that is late. Okay, now you will have to tell me what was the answer or what was the question. Answer, suppose this are the contraction, variable is anytime, variable not connection. So it can come like this, it will change. So it can come before, after, with. So this is your variable deceleration. Okay sir, here the contraction is coming, the heart is dropping down before also, heart rate, with also, just before also, after also, it can drop down with also. So it's a completely variable pattern which you get in cord compression. So what was the picture? If somebody can tell me, confirm, because I know this is going to be, many students have told me कि sir both question, मतलब किसी ने mirror तो नहीं था, mirror was not there, everybody has told me. So if late and variable में you have to keep in mind. Okay, so I'm showing you both. Okay, yes, a diabetic lady already on insulin and HbA1c is very high. What are the complications if the HbA1c is very high? Sir, when the HbA1c is increased, there is a risk of anomaly in the baby. anomaly and abortion risk is very, very high. And therefore, my dear student, you don't tell the patient you conceive. No, that is wrong. You don't plan to conceive. First, I have to increase the dose of insulin. I'm sure many of you will got it correct. Reduce the HbA1c level, preferably to less than 6.5, less than 6 is better, best hai, and then only plan to conceive. Yes or no? Was this the question? If there was some changes in the question, all of you can tell me. Is this clear to all of you? Okay, so please keep this in mind. Okay, moving on. So basically HbA1c, yes, this was a very good question. I'm so happy we teach it. And kya hai? Okay, not this one. Yes, this one. Okay, so here kya hai? Please pay attention. Okay, the head is floating. Was the word given floating? Yeah, unengaged. Head is 5 by 5 palpable. That means, sir, the baby head is over here. Head has not yet entered the pelvis. And therefore, whenever it is very dangerous. In fact, it's a contraindication. Okay, you should not do a ARM actually. Okay, you should not do a ARM when the head is floating, and therefore what can happen? Sudden fetal heart rate, cord prolapse, HbA1c high was given. Yes, very okay. So cord prolapse can happen. That gives us to sudden fetal bradycardia. Always remember after ARM, because when the membranes ruptured, the baby ka jo umbilical cord hai, the baby ka umbilical cord will prolapse, and that cord prolapse, all of you know, gives rise to the whole cord can go in cord prolapse, gives rise to severe acute fetal distress. That's the reason of sudden fetal bradycardia. That is severe fetal distress. So in a floating head, very good. All of you must have got it correct. Cord prolapse. Uterine abruption, you will see bleeding. You will see on ARM, you will see bleeding. Okay, yes, if you see bleeding, blood stained liquor, bleeding is there, and abruption mein blood stained liquor, and rupture uterus is after long term. Okay, heart rate 80 tak tha, very good. Heart rate dropping down to 80 per minute. Fetal heart rate 80 per minute, very good. That is a severe bradycardia. Okay, rupture uterus mein kya? Prolonged use, excessive oxytocin is used. Then rupture uterus, suddenly the baby part will reside, loss of station, and baby can die. Sudden IUF, baby will die. Okay, and rupture uterus, mother will also go in shock. So rupture uterus mein, in rupture uterus, the mother is in shock. The mother also goes in shock, and just by doing oxytocin augmentation, you don't prolong labor, prolong labor, obstruct labor, and if lot of oxytocin is used, then rupture uterus may receding, the loss of station, baby goes back inside. So loss of station. Okay, is this understood to all of you? Yes. Now this was a very good question. Like probably like a NEET PG level or some tough question was there. Okay, sir, on pap smear. Now please pay attention. If a pap smear screening is done, and if it is only atypical cells, okay, so whenever the pap is abnormal or pap smear is showing dysplasia, then I would want to go and do a cervical biopsy with colposcopy. This I will do 5 by 5 head. Yes, very good. Okay, 5 by 5 head means completely palpable. Okay, head is completely palpable. That is 5 by 5. Okay, we see that head is completely palpable. That means it's an unengaged head. Basically, uska matlab ye hai. When the head goes in, we say 1/5, 2/5. Okay, yes. So here, please pay attention. When it is only abnormal pap, we definitely want to go and do a cervical biopsy and colposcopy. Never jump in for hysterectomy. But here, atypical glandular cells. Now, can you tell me glandular cells which are atypical tells you what? Atypical glands. Glands kahan se hai? Yes, sir, atypical glandular cells is I have to also think of, it is your abnormal, it is your endometrial cancer also. Endometrial se aa raha hai, I need to rule out endometrial cancer also. Is this understood to all of you? And therefore, we will go with not only endometrial biopsy, endocervical, yeah, basically cervical biopsy, but also endometrial biopsy. Of course, that means, of course, ye endocervical matlab cervical biopsy. So it's like A, B and C together. Of course, we can also do you will do a colposcopy plus cervical biopsy. Yes, to rule out any cervical cancer, but also endometrial biopsy should be done because it is a atypical glandular cells. Is this understood to all of you? Just because it is atypical glandular cells दिया है, it is better to do a endometrial biopsy also. If it was only pap smear abnormal, then if you mark this cervical biopsy and colposcopy, that becomes the answer. So you have to tell me in the question कि abnormal glandular था क्या abnormal खाली abnormal pap smear था. Yes, I'm sure all of you must have got it correct. Pathology teacher must have also shown you this picture. We have also shown you menstrual bleeding, heavy menstrual bleeding, and severe dysmenorrhea in a multiparous patient. Multiparous patient hai, and menorrhagia, dysmenorrhea, and you can see, yes, black spots rahenge, glands, okay, chocolatic hemosiderin deposits. What is it? What is it? Beta, growth on the cervix, if it is a James Bond, if it's a growth on the cervix, then you do a punch biopsy. Okay, if they tell you there was a growth on the cervix, was there a growth on the cervix mentioned to you? And when there's a growth on the cervix, then there's no point doing pap smear. Then you directly do the punch biopsy. If I can see the growth on the cervix, yes, and it is a diffuse enlarged uterus, yes, and this is your adenomyosis. Yes or no? Thoko tali, clap. Clap. I'm sure all of you must be clapping and jumping in the exam, seeing this, seeing the question paper is what all of you have told me. So this is adenomyosis. Why? Because multiparous patient, menorrhagia, dysmenorrhea, and on hysterectomy, you get hemosiderin, like you are seeing black, like multiple glands within the myometrium. Moving on, again a simple question. कर्डी वाइट डिस्चार्ज, कर्डी वाइट डिस्चार्ज किसमें होता है? कैंडिडियासिस. ओके, कैंडिडियासिस में कर्डी वाइट डिस्चार्ज, candidiasis में कर्डी वाइट डिस्चार्ज, and you get what you get, clue cells are seen in sir bacterial vaginosis जिसमें grayish white discharge होता है. Flagellate organism is suggestive of trichomoniasis where you get a greenish yellow discharge. Okay, and here you get pseudohyphae and spores is your fungal infection. It was a fungal infection, pleuritis and candidiasis. Curdy white discharge was mentioned. Yes or no, Balaji? But clue cells are seen with, yes, bacterial vaginosis. Correct. Is it clear to all of you? OT वाला इमेज किसमें था बेटा? RR वाला, I don't know. Okay, yes. So pseudohyphae and spores, that is your this. Okay, yes, this was a very good question. And I'm happy कि ये क्या था कि patient is in labor for 8 hours. That's fine. She's up to 6 centimeter dilated. Vertex is at station 0. Okay, so head is at the level of ischial spine, and clearly I'll show you the occiput is felt at 4 o'clock position. Okay, sagittal suture is in oblique diameter. Okay, and okay, so all of you pay attention whether it is all of you. So this is the pelvis, all of you know this is pubic symphysis, which is anteriorly, this is the sacrum, which is posteriorly, and this is the fetal head. Very good question. Okay, this green part is the fetal head. And suppose they say, all of you look on the board, okay, suppose they say that occiput was transverse, okay, which came in the last time. Okay, if they tell you, okay, sir, occiput is at 9 o'clock, okay, occiput is at 9 o'clock and the patient is fully dilated and not coming down, that is your deep transverse arrest, when the occiput is transverse. Okay, so when the occiput is transverse, okay, occiput is transverse दिया है, then and the patient is fully dilated, then deep transverse arrest. Yes, very good, Dr. Pu. Okay, here क्या दिया था? The sagittal suture is in the oblique diameter. That means here. Okay, right oblique left. That means here like this. Okay, so 3 o'clock, 4 o'clock, यहाँ पे like this. Okay, so I'm just showing you like this. This was the question given to you. Okay, sir, this. So this will just rub it. ये rub कर देंगे. This was not there. This is just to show you extra information. Okay, so when in deep transverse arrest, occiput is transverse. So sir, in deep transverse arrest, occiput could be at 9 o'clock or 3 o'clock. Okay, yes, and this was the question. Okay, so sagittal suture is running in the oblique plane, so occiput is here, and of course if it's on this side then it will be here. Okay, if the occiput is on this side then it will be somewhere over here. Okay, so whenever this is your oblique, this and this we see in occipito-posterior position. Deep transverse arrest ke liye you need to have full dilatation, and occiput I told you transverse. Occiput is transverse. Okay, and all of you know brow mein what you feel. Brow mein you feel the anterior fontanelle very well, and brow mein we feel the supraorbital ridges. Haven't I taught you tough MCQ? Okay, sir, you feel the anterior fontanelle as well as supraorbital ridges. Face mein to I have told you feel the belly baby ka malar, mentum, nose, mouth, all that you feel in the face presentation. Okay, so occiput, interfrontal exit palpable, occiput is at, I think occiput, what exactly was given? Occiput at 4 o'clock, occiput position mention kiya tha, and sagittal suture in the oblique diameter. This is definitely occipito-posterior. We can wait. If it's rotating or not, we can check and see. Okay, if it is a posterior rotation, we can also have a face to pubis delivery. So this is your OP, occipito-posterior, to begin with. Very good. Okay, again postmenopausal bleeding. Postmenopausal bleeding patient is there, and endometrial thickness is mentioned or not mentioned, can you tell me? But a lady who is postmenopausal and comes with bleeding PV, I told you histopath HPE is mandatory. या बेटा वो आ रहा है, ट्विंस का क्वेश्चन आ रहा है, mandatory. Okay, histopath is mandatory. Do not directly do the hysterectomy. Pap smear has got no role over here, and we would want to do a endometrial biopsy or a DNC or even hysteroscopy biopsy. That is it, endometrial biopsy, because HPE is mandatory. Why you want to do? To rule out yes, okay. हाँ, OT में जो डिसेक्शन करते हैं वैसा वाला पिक्चर. Very good, that's what I've shown you. Okay, so rule out endometrial cancer. Okay, you need to rule out endometrial cancer. Some student told me, okay, sir, based on this concept, 2-3 questions had come. Yes or no? 2-3 questions have come from the same concept. Okay, so if it is not only postmenopausal lady, suppose it is also perimenopausal. Okay, perimenopausal also, if they tell you with heavy menstrual bleeding, also you need to rule out endometrial hyperplasia and endometrial cancer, and that is by HPE. Histopathological examination is mandatory. Okay, so this is postmenopausal lady, and I told you postmenopausal may always the thickness should be less than 4 millimeters. Okay, was the endometrial thickness mentioned? Endometrial thickness बताया था, यहाँ पे बता देना. Yes, this is again a easy question. Many of you must have got it correct. Postmenopausal bleeding था, means I'm not sure this question was there or not there. Many students told me था नहीं था. Obese patient, diabetic patient, and there is a fungating growth inside the uterus. Okay, uterus के अंदर there is a fungating growth which is also invading into the walls and complete uterus. You can see tube, uterus, ovary, everything is removed. So this is your endometrial cancer. Is it mentioned? Mention how much endometrial thickness mentioned. How much beta in famous 8 millimeter ही था. Endometrial thickness 8 millimeter. So that is increased. Okay, endometrial thickness is increased because it should be less than 4 millimeter. Okay, was not mentioned. ठीक है. Okay, so you know adenomyosis we have discussed कैसे दिखता है. Endometriosis generally young patient. Fibroid is also in a young patient. Fibroid will not present with postmenopausal bleeding. Okay, fibroid में postmenopausal bleeding नहीं होता, and fibroid is a localized growth. Okay, this is fungating growth invading into the muscle. This is your endometrial cancer. Okay, very nice question. Many of you may have got it correct. Okay, ये क्या था, कौन सा fruit? Okay, so this is just a myth. It is a misconception. कि papaya and pineapple both. Many countries, many areas में pineapple का भी ना बोलते हैं patient को खाने को, but of course it is a wrong concept. It's a misconception. There is no a fruit which is dangerous to the baby. There's a thought that papaya से abortifacient. There are so many patients who don't get period. Sir, I'm eating papaya. Papaya वो heaty होता है, गर्म होता है. ऐसा कुछ नहीं होता है. ये सब कचरा डस्टबिन है. Papaya and pineapple question आ गया तो pineapple. Okay. Actually जो item, only dietary item which you tell to restrict during pregnancy is caffeine. Caffeine intake should be told to be restricted. Okay. Actually, which is genuine, logical, on scientific. Okay. This is all misconception. I'm telling you on science. Based on clap if you have learned something new, on scientific evidence कि restricted caffeine we should tell the patient 1 cup 2 cup is okay. बहुत ज़्यादा कैफीन लेने से प्रॉब्लम हो सकता है. पपाया, पाइनएप्पल, ऑल फ्रूट्स आर सेफ. मैंगो, बनाना, जो खाना है खा सकते हैं. ओके, यस. आई एम नॉट श्योर अगेन दिस क्वेश्चन वाज देयर और नॉट. ये पीडियाट्रिक्स में भी आ सकता है कि अ यंग गर्ल हैज कम टू यू, असिमेट्रिकल ब्रेस्ट डेवलपमेंट, नथिंग टू बी डन. इट इज वेरी नॉर्मल, फिजियोलॉजिकल है. यू डोंट नीड टू डू बायोप्सी एंड मैमोग्राफी. व्हाट इज इट? जस्ट रीअश्योर द पेशेंट. Just reassure the patient. थोड़ा breast symmetrical enlargement हो सकता है, nothing to be done, and that was the question. Okay, again the framing may be slightly different, but it's a very similar question. Supine hypotension. Okay, sir, in the 3rd trimester or also in the 2nd trimester, patient gets dizziness and the blood pressure is low. BP is found to be low, isn't it? What were the options? Yeah, papaya correct, beta. Papaya correct. Okay, the question is what is it? Sir, plasma volume, cardiac output also increases. There is increase in the cardiac output also, there is increase in the plasma volume also, but very importantly the decrease in the peripheral resistance. Okay, and the gravid uterus, also remember the IVC written. Okay, the gravid uterus compresses the IVC. So this is another question. Matlab similar question can also be asked to you. Yeah, misconception question. Why do NMC? I know why they shouldn't have this. Just actually probably time pass MCQ था. General knowledge पे एक डाल दिया. Actually question का कोई sense नहीं बनता. It's a misconception. Absolutely correct, Dr. Apu. तो नहीं देना चाहिए था. But yes, okay. So this is again the same thing that on supine position. Okay, when the patient lies down, also supine. Okay, supine position में भी हाइपोटेंशन होता है. सुपाइन हाइपोटेंशन भी सिमिलर कॉन्सेप्ट दी है कि सर देयर इज इन डिक्रीज इन पेरिफेरल वास्कुलर रेजिस्टेंस एंड ग्रेविड यूट्रस कंप्रेसिंग, इंक्रीज कार्डियक आउटपुट वाज आल्सो देयर, बट आंसर ऑल ऑफ यू नो व्हाट वाज इट. ओके, यस, आई एम श्योर ऑल ऑफ यू मस्ट हैव गॉट इट करेक्ट. नॉर्मली एक्चुअली लकीली दोनों नहीं दिया था. लेडी हैज डिलीवर्ड IUFD. व्हाट इज द ड्रग फॉर लैक्टेशन सप्रेशन? ऑक्सीटोसिन you don't give. Oxytocin injection you give. There's breast engorgement. There's breast engorgement is there just for her to release the milk out. Release the milk, we may give oxytocin. Here we want to give bromocriptine. Bromocriptine, or if not cabergoline. Okay, cabergoline is also what is more commonly we use in our practice. Cabergoline. But bromocriptine was the option given in the question paper. So that's what all of you told me. Cabergoline bhi dete hain. They are, because remember, dopamine inhibits prolactin. So all these are dopamine agonist drugs. Okay, dopamine inhibits prolactin. Dopamine inhibits prolactin, and therefore dopamine blocker will cause galactorrhea, but dopamine agonist. Okay, so bromocriptine and cabergoline. Bromocriptine is the answer. I'm sure all of you must have got it correct. It's a pharmac MCQ also. Okay, yes. Now this was the MCQ, and many of you have told me, okay, what was the sign? Lambda sign or the twin peak sign. Of course, we had discussed it, and this is what? So this arrow is not there, but basically if you see, so this vertical line is the membrane. The membrane goes here, and the placenta runs for some distance in between the fetal membrane. Okay, you can clearly see a yellow color placenta invading. Yes or no? Was this the picture? Very similar picture was given. This is a lambda sign or the twin peak sign. What does it suggest? Very good, excellent. Okay, sir, one baby is over here. So this is one baby, another baby is over here, and basically this sign remember is telling you 2 fused placenta. This is a sign which is showing you DCDA. Very good. DCDA, image based question. All of you correct. What do I get it in MCDA? Sir, in MCDA, we can get a T sign or a inverted T sign. थैंक यू नेम, थैंक यू. ओके, वाई जैसा दिख रहा था. वेरी गुड जेम्स, वाई जैसा दिख रहा है. करेक्ट, ये वाई जैसा ही दिख रहा है. करेक्ट, एब्सोल्युटली करेक्ट. ये वाई, उल्टा वाई, दैट्स कॉल्ड अ लैम्बडा साइन और अ ट्विन पीक साइन. वाई जैसा दिख रहा था तो आंसर करेक्ट है तुम्हारा. ओके, T sign or a inverted T sign that is seen in monochorionic diamniotic, MCDA. Okay, ये extra information. Okay, and very important. I'm so happy. इसमें था again, was it a USG? Was a picture given with this or not? इसके साथ पिक्चर था कि नहीं? Endometrial polyp is seen. Polyp में क्या था? Feeding vessel sign is seen on color Doppler. Why? Because sir, whenever there is a polyp, inside the core of the polyp, a blood vessel runs. A blood vessel runs, and that blood vessel we can pick up on color Doppler. That is the feeding vessel sign. Feeding vessel sign is suggestive of a polyp. And what do we do? Only DNC we don't do. You will miss the polyp. Yes, I've taught you. And so happy. हम लोग गेम खेलते थे, हिस्ट्रोस्कोपी, लैप्रोस्कोपी. Polyp is within the cavity. Was there an image with it? ऐसा image था. So this is a hysteroscopy. So this is a hysteroscopy, and we can see a growth or a endometrial polyp. Polyp is within the cavity, and the endometrial polyp can cause menorrhagia, heavy periods. It can also rarely cause infertility. No image was shown. Very good. So keep this in mind. So this is a virgin image. This is a hysteroscopy image. Very good. Image नहीं था, मुझे भी वही लगा. Okay, then, and what do we do? Yes, hysteroscopic polypectomy. How many of you have got this correct? Hysteroscopic polypectomy was the answer. Hysteroscopic polypectomy should be done. We don't do a laparoscopy surgery. We don't do a hysterectomy directly, never. Okay, hysteroscopic polypectomy, you can go through the hysteroscopy route and just cut this polyp out and get it out and send it for testing. Is this understood to all of you? So this was your hysteroscopic polypectomy. Okay, so we can almost, we've got 28 to 30 questions were there. As you know, OBGY is the single most important subject. 30 MCQs come every year. I must have got around 28 to 30 MCQs for sure. And one more question was there, which was there. One was that, sir, I think non-responding of iron deficiency anemia. I think iron deficiency anemia, not responding to the iron tablets and folic acid, then that's your thalassemia, thal tha. Okay, that you can check. And one was LNG IUD. LNG intrauterine device was there, and she's having slightly spotting. Again, remember this, that when I insert a LNG IUD, अच्छा ओवरी जैसा, अच्छा हिस्टोस्कोपी में ओवरी जैसा नहीं दिख रहा है, हिस्टोस्कोपी में ये पॉलिप है. ये दिस इज अ पॉलिप विच यू सी. ओवरी इज आउटसाइड द यूटर. ओके, सो दिस इज लाइक अ एंडोमेट्रियल पॉलिप विच यू सी. यस, एंड LNG IUD स्टार्टिंग में अगर इरेगुलर ब्लीडिंग स्पॉटिंग है, यू कैन रीअश्योर द पेशेंट बिकॉज इट इज नोन टू हैपन. इट्स अ नोन थिंग. कंप्लीट अमेनोरिया पेशेंट को धीरे धीरे आता है. व्हेन आई यूज LNG IUD फॉर अ पेशेंट ऑफ मेनोरेजिया, हेवी मेंस्ट्रुअल ब्लीडिंग, there is going to be, yes, more than 30 years name. Okay, and then you have to just reassure the patient. Don't jump in for removal. Reassurance is there and it will become better. Okay, and all of you, my dear students, those who are preparing for the June examination and the upcoming next year examination, you can see so beautiful colored notes. Every student has told me कि sir, once we have seen your lectures, 2 to 3 hours में सारे notes हम revise कर सकते हैं. And so happy to announce the Republic Day sale is on. Those who are very sure of clearing the FMGE examination can join in for the NEET PG Masterclass, and jiska exams have been okay, or those who are doubtful, do not waste time, start your preparation. And those who are preparing for the next June, July and next December, 6 months and 12 months Masterclass is also available. Okay, and Republic Day sale is on, and just in 1500 rupees you get everything. My timetable guidance, I'm personally guiding all the students how to study, how to prepare. This is the WhatsApp number, and please download the OGGuru app and share this video with all your friends and colleagues. And please follow me on Insta, कल भी रील डाला था. And please subscribe to the YouTube channel and hit the like button, share button, and if you are hype, thank you Balaji, and so many thank you. Okay, thank you. So please put all these comments when the stream is over, live stream end ho jayega. Please, I want all you students, all my OG Guru fans, just go in the stream and put the comment in the stream also. Okay, thank you very much. Okay, I'm very happy. Almost every question, not almost, each and every question was from our lecture series, and I'm sure all my students, you must have got fabulously done. And I think 28 29 to marks aapka sure hai OBGY mein with this kind of thing. If this was the paper, yes, it was a relatively very easy paper, except one jo OP ka question tha, analytical glandular cells. 3 wrong, no problem, beta. 3 wrong, still 26, 27 in OBGY. That means you're clearing for sure. Because in one chunk, that is the advantage of OG Guru. And in one chunk, 30 to 35 questions come every year. And if in one subject only you can easily score 27, 28 out of 30, which all of my students do, you can easily cross 150 barrier. Okay. So here's wishing you best of luck for all the examination. I'm always there to available. Download the OG Guru app and get in touch with me on this number on phone and WhatsApp. Bye-bye. Best of luck. Thank you very much. As I said, this is a recall session. You are feel to WhatsApp me if some option was different in your paper or some you felt was different. You can always WhatsApp me. Neeraj Yadav, only one wrong. Excellent. Okay, superb, love it. Okay, so bye bye, best of luck, thank you very much, and I'll be waiting to hear from you on the day of your results. And please subscribe to the YouTube channel also. Bye bye, best of luck, thank you very much.